What's up, FRT community? So as AZZ has a question about a muscular dystrophy patient that was on a BiPap, had a lot of oral secretions. They took them off the BiPap. The nurse suctioned with the yonkers. They placed them back on the BiPap. During that time, the patient desatted to the 70s, and the clinical instructor, I guess, got a little upset and said, hey, the patient's too sensitive to be taking him off the BiPap. What are my thoughts on this? I got thoughts on this, but before I get started on those thoughts, I want to point something out. Look at this shirt, guys. Seminole State. This is out of Florida, okay? This is a respiratory therapy program, a college that's in Florida. And I told you guys almost a year ago that if you send me a shirt from your school or your program, it can be a respiratory therapy, your program shirt, or it can be just a general Seminole State school shirt, that I'm going to send you a shirt, okay? Got my first shirt, Seminole State. A year ago, I said I'd love to represent colleges all over the country. Shit, I'd love to represent colleges all over the world. You send me a shirt, and I'm going to send you a shirt, okay? So that's where I want to start this video. I thank Marilyn for sending me this shirt. It was a nice Christmas gift. I received it in the mail 2 days ago. I said, I gotta give it shout out to it. I gotta say it. I'm gonna put your shirt on also, and I'm gonna give your school a shout out, and I'm gonna say, Seminole State, keep doing what you're doing. Keep putting out respiratory therapists that are meeting the needs of the patients in the Florida community, period. Hands down. Okay? So I want to start with that. Now, back to the original statement. The reason that I'm making this video is to address this question from Az, who wants to know about this muscular dystrophy patient. Lots of oral secretions on BiPap, took them off. A nurse oral suction with the yonkers, put back on. SATs fell to the 70s. Clinical instructor got upset and said, don't do that. The patient's too sensitive to do that. Here's my thoughts on it as, first of all, I need more data. Okay, that's the first thing. I need to know what the BiPap settings were, and I need to know what the FiO2 was. I need to know what the patient's overall state was. I need more data to really answer this question, but I can give you a preliminary answer. Excessive oral secretions for a patient on BiPap is a problem. That patient is at risk for aspiration. And so I don't think you did the wrong thing in taking them off and allowing the nurse to suction. Okay, now one of these days you'll be taking them off and you'll be doing the suctioning. So I don't have a problem with that. I think the question lies, what did you do before you took the patient off? Did you know that they were at risk for desatting? Did you know that there was hypoxemia risk prior to taking them off? If so, or even if not, did you hyperoxygenate this patient before taking them off? That's the key. If you want to know, me as an instructor, you're telling me this scenario. I have a couple of things I'm going to say, but here's what I want to know. Did you hyperoxygenate the patient? Because I think taking them off and suctioning is a good thing, because we know that they're at risk for aspiration because of the excessive oral secretions. That makes sense. But did you hyperoxygenate prior to taking the mask off? Yes or no? If the answer is no, that's where that's where you messed up. You got to understand that when you take somebody off of non-invasive mechanical ventilation, you're removing PEEP, you're also removing inspiratory efforts. Now when you do that, you put that patient at risk for hypoxemia. To combat the risk of hypoxemia, we hyperoxygenate our patients. Now the second thing you need to know, and this is probably where your clinical instructor was coming from, is this. As a student, you are working under the license of your clinical instructor. So the next best thing the first thing you could have done before talking about hyperoxygenation is letting your clinical instructor know what your intentions were. Go to them and talk to them. All respiratory therapy students, pay attention in clinic. Anytime you're going to do something that is going to put your patient at risk, talk to your clinical instructor first. Because you are operating beneath that clinical instructor's license. If that patient codes and dies, that's the clinical instructor's license on the line, not your education. Okay? And maybe in some institutions they would say that was unsafe and you're out. So maybe it is your education. Some institutions would say clinical instructor should have been better. It just depends. But definitely your clinical instructor license is on the line for that patient. So just talk to your clinical instructors. When the patient needs to be suctioned, and if they're on BiPap and they need to come off the BiPap to be suctioned, relay that message to your clinical instructor. Tell the nurse, because this is probably what happened. Probably at the bedside, you're probably doing a BiPap check or a BiPap assessment. You're probably in the room and the nurse is saying, hey, we need to suction this patient. She's got lots of oral secretions. Will you take the BiPap off for me? And you took the BiPap off, and that's fine. Okay? But what should have happened in that context is this conversation. Can you give me 2 minutes to go find my clinical instructor, let that person know what is going on and what needs to happen, so at the very least that clinical instructor can be present during the time. Now, a quality clinical instructor is going to say, fantastic idea. I love your train of thought. Yes, let's go suction the patient. We don't want them to aspirate. But that clinical instructor, right before you take that mask off, is going to say, hold up. We should probably hyperoxygenate this patient. And you'll hyperoxygenate them. And that will be the learning moment for you as you become a respiratory therapist to remember that you were about to take a BiPap off without hyperoxygenating your patients on a sensitive patient. That's what this all comes down to. Yes, the patient needed to be suctioned. Yes, you got to take the BiPap mask off to do so. Yes, yes, yes. How do I prevent the sats falling from 90 to 70? You hyperoxygenate the patient, and you have your clinical instructor present during this time. If it's with a patient that could potentially go south, maybe even if it's not. I mean, it's never a bad idea to go to your clinical instructor and say, this is what we need to do. Will you be present while we do it? Because it's that person's license that's on the line. So that's my thoughts on your scenario. I feel bad for you because I feel like you kind of got, kind of in trouble or kind of reprimanded for doing the right thing. It just may have been steps that could have been done prior to that would avoid it, or there may be something that the clinical instructor could have guided you along better along the ways. So just learn from it. That's all this comes down to. Learn from it. Remember this scenario the next time you have a BiPap patient that you have to take off to suction. Use it to learn from. Learn from every clinical experience, not just the ones you get reprimanded on, but every clinical experience. Take it to heart and learn from it, guys. That's what you're doing. You're future respiratory therapist. You're learning how to perform this craft at the highest level and at the safety of the patients. So learn from everything and just keep going out there and keep being great. Okay? Best wishes, guys.